thousands of people unknowingly live with a ticking time bomb, cardiovascular disease. This silent killer can linger undetected, showing no obvious symptoms until it strikes suddenly and without warning. But here's the good news: you have the power to catch it early, and early detection could save your life. Did you know that 1 in 4 deaths in America is caused by heart disease? That's a staggering number, and it's a reality we can't ignore. Just this year alone, over 805,000 Americans will suffer a heart attack, with nearly 165,000 people losing their lives to this disease. However, when warning signs are recognized early, survival rates increase dramatically. That's why recognizing subtle warning signs is crucial. Don't brush off changes in your body, pay attention. In this video, we'll uncover 7 early signs of a heart attack you should never ignore. Your health is worth it. Understanding heart attacks. Let's take a moment to understand heart attacks and why it's so important to pay attention to your health. The heart is a powerful muscle that pumps blood throughout your entire body, supplying vital oxygen and nutrients to every cell. It's responsible for keeping you alive every second of every day. When we talk about heart attacks, the medical term is myocardial infarction, which occurs when blood flow to part of the heart muscle is blocked. This blockage is typically caused by a buildup of fat, cholesterol, and other substances that form plaque in the coronary arteries. Here's the tricky part: not all heart attacks are the same. Some occur suddenly with intense symptoms, the classic movie heart attack where someone clutches their chest and collapses. These are the ones most people recognize. But then there are those that start slowly with mild pain or discomfort. These silent heart attacks can be just as dangerous but often go unnoticed, creating a false sense of security that delays critical medical care. That's why knowing the signs and acting early is so crucial. The 7 early warning signs. Let's dive into some of the most common early warning signs of a heart attack. These might seem subtle or easy to overlook, but paying attention to them could make all the difference. 1. Chest discomfort or pain. Have you ever felt an uncomfortable pressure, squeezing, fullness, or pain in the center of your chest? Maybe it lasted more than a few minutes, or went away and came back. Chest discomfort is the most common symptom of a heart attack and can manifest in various ways. Some describe it as uncomfortable pressure, others as squeezing or fullness. It might even feel more like heartburn or indigestion than pain. Why does this happen? When one of your coronary arteries becomes blocked, it cuts off blood flow to part of your heart muscle. Without oxygen, the heart tissue begins to die, sending pain signals that you feel in your chest. It's worth noting that conditions like acid reflux, muscle strain, or even anxiety can also cause chest discomfort. But here's the key: if you notice persistent or recurrent chest discomfort, especially if it's accompanied by other symptoms, don't dismiss it as just indigestion. This is your body's way of signaling that something might not be right. Remember, early detection can significantly improve your outcomes. So if you're experiencing unusual chest sensations, don't wait, call emergency services immediately. A quick response could give you more than peace of mind, it could save your life. 2. Shortness of breath. Finding yourself suddenly winded during routine activities? Perhaps you're struggling to catch your breath while sitting still or waking up gasping for air? Unexplained shortness of breath, particularly when it occurs alongside other symptoms, can be an early warning sign of a heart attack. Why does this happen? When your heart isn't pumping efficiently, blood can back up in the lungs' blood vessels, causing fluid to leak into air sacs. This makes gas exchange more difficult, resulting in that breathless feeling. Additionally, when your heart muscle is damaged during a heart attack, it can't pump enough oxygen-rich blood to meet your body's needs, triggering breathlessness. While respiratory conditions, allergies, anxiety, or being out of shape can also cause shortness of breath, what makes heart-related breathlessness concerning is when it occurs without obvious triggers, comes on suddenly, or worsens over time. If you find yourself unexpectedly short of breath, especially if it's accompanied by chest discomfort, nausea, or lightheadedness, don't wait to see if it passes. Seek medical attention right away. Respiratory distress can quickly become life-threatening, and it's always better to err on the side of caution when it comes to your heart. 3. Pain that radiates. Have you experienced pain that seems to spread from your chest to your shoulders, arms, back, neck, or jaw? This radiation of discomfort is a classic warning sign that your heart may be in trouble. Why does this happen? Heart pain often radiates because of how your nervous system is wired. The same nerve pathways that serve your heart also connect to other areas of your upper body. When your heart sends pain signals, they can be perceived in these connected regions. Particularly concerning is pain that travels down the left arm, a hallmark symptom of heart attacks, although it can also affect the right arm, both arms, or even present primarily in areas other than the chest, such as the jaw or back. It's important to note that conditions like muscle strain, arthritis, or even a pinched nerve can cause radiating pain. However, heart-related pain typically appears suddenly, often during physical exertion or stress, and may be accompanied by other symptoms. If you notice unexplained pain radiating from your chest to other parts of your upper body, especially during exertion, don't dismiss it. Immediate medical attention could be the difference between life and death. When minutes matter, every second counts. 4. Cold sweats and clammy skin suddenly breaking out in a cold sweat for no apparent reason? Finding your skin unusually clammy or pale? These seemingly minor symptoms could actually be your body's response to a heart attack in progress. Why does this happen? When a heart attack begins, your body activates its fight or flight response, releasing stress hormones like adrenaline. Your nervous system also triggers increased sweating to help cool your body down, preparing it for perceived danger. Additionally, as your heart struggles, blood is redirected to vital organs and away from your skin, causing that pale, clammy appearance. While anxiety, stress, physical exertion, or even menopause can cause sweating, heart attack-related sweats often come on suddenly, feel different from normal perspiration, and are typically accompanied by other concerning symptoms like chest discomfort, nausea, or shortness of breath. Cold sweats, particularly when they occur during rest or without explanation, are your body's way of signaling distress. Don't ignore this warning. If you experience unusual sweating, especially alongside other symptoms described here, seek emergency medical care immediately. This subtle sign could be your body's desperate attempt to tell you something is seriously wrong. 5. Unusual fatigue or weakness, experiencing overwhelming, unexplained fatigue that doesn't improve with rest? Finding yourself unusually weak or so tired that simple tasks feel impossible? This extreme exhaustion, particularly when it comes on suddenly, can be an early warning sign of heart problems. Why does this happen? During a heart attack, your heart cannot pump blood effectively, which means your cells aren't receiving the oxygen and nutrients they need to function. This creates an energy crisis in your body, resulting in profound fatigue. Women in particular often report extreme fatigue in the days or weeks before a heart attack. It's important to distinguish between normal tiredness and heart-related fatigue. Normal fatigue improves with rest, is usually explained by your activities, and affects your whole body evenly. Heart-related fatigue often feels crushing, doesn't improve with rest, and may be accompanied by weakness in specific areas. While conditions like anemia, depression, thyroid problems, or simply lack of sleep can also cause fatigue, unexplained extreme fatigue that comes on suddenly and persists should never be ignored, especially if you have risk factors for heart disease. Listen to your body. If something feels dramatically different about your energy levels, don't wait to seek medical advice. This overwhelming fatigue could be your body's way of telling you your heart is struggling. 6. Nausea, vomiting, or indigestion, feeling unexpectedly nauseated? Experiencing unusual digestive discomfort or even vomiting without any apparent cause? These stomach-related symptoms might seem unrelated to your heart, but they can actually be warning signs of an impending heart attack. Why does this happen? Heart attacks can stimulate the vagus nerve, which connects your heart, brain, and digestive system, triggering gastrointestinal symptoms. Also, when your heart isn't pumping efficiently, blood flow to your digestive organs decreases, causing nausea and digestion problems. Women, elderly people, and those with diabetes are particularly likely to experience these symptoms during a heart attack. While food poisoning, viruses, stomach ulcers, or countless other issues can cause digestive distress, what makes heart-related nausea concerning is when it appears alongside other symptoms like chest discomfort, shortness of breath, or unexplained sweating. Don't be quick to dismiss unexpected digestive issues as merely something you ate, particularly if you have heart disease risk factors or if the symptoms feel different from your typical stomach problems. If unusual nausea, vomiting, or indigestion occur, especially with other warning signs, seek emergency care. These symptoms may be your body's unusual way of alerting you to a heart emergency. 7. Anxiety or sense of doom. Have you ever experienced an overwhelming feeling that something is terribly wrong? A sense of impending doom or unusual anxiety that you can't explain? This psychological symptom may actually have a physical cause, your heart sending distress signals to your brain. Why does this happen? During a heart attack, your body releases stress hormones like adrenaline in response to the crisis. These hormones can trigger intense feelings of anxiety. Additionally, your brain may be receiving signals that your body isn't getting enough oxygen, creating a sense of panic or doom even before other physical symptoms become apparent. Many heart attack survivors, particularly women, describe experiencing an unexplainable feeling that something terrible was about to happen in the hours or days before their heart attack. This isn't just ordinary worry, it's a profound sense that something is very wrong. While anxiety disorders, panic attacks, and stress can cause similar feelings, heart-related anxiety typically comes on suddenly, often feels different from your usual anxiety, and may be accompanied by physical symptoms. Never dismiss these feelings, especially if they're unusual for you or extremely intense. Your intuition about your own body is powerful and worth trusting. If you experience an unexplained sense of doom, particularly alongside any other symptoms described here, seek emergency medical attention immediately. These feelings may be your body's earliest warning that your heart is in danger. Risk factors for heart attacks. Understanding the risk factors for heart attacks can help you stay vigilant and proactive about your health. Heart disease risk increases significantly with age, after 45 for men and 55 for women, but heart attacks can strike at any age. Regular screenings become even more important as you get older. If heart disease runs in your family, your risk is higher. Having a parent or sibling with heart disease, especially at a young age, significantly increases your chances. Genetic factors influence how your body processes cholesterol and responds to inflammation. Studies show that certain ethnic groups face higher heart attack risks. African Americans have higher rates of high blood pressure and diabetes, major risk factors, while South Asians often develop heart disease at younger ages and with different symptoms. Your lifestyle choices make a substantial difference. Smoking damages blood vessels and reduces oxygen in your blood, dramatically increasing heart attack risk. High blood pressure, cholesterol, diabetes, and obesity are all major risk factors that can be modified through lifestyle changes. While you can't control factors like age or family history, you can take steps to manage lifestyle risks. Knowledge is power. Stay informed and proactive with regular checkups and healthy habits. Early awareness can save lives. Prevention strategies. Taking steps to reduce your risk of heart attack is one of the most empowering things you can do for your health. While no prevention strategy is foolproof, adopting certain habits can significantly lower your risk and improve overall well-being. What you eat plays a vital role in heart health. Focus on a Mediterranean-style diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Foods high in omega-3 fatty acids like salmon and walnuts, as well as antioxidant-rich berries, can be particularly beneficial. At the same time, limit processed foods, saturated fats, sodium, and added sugars to reduce inflammation and overall heart risk. Staying physically active isn't just good for your waistline, it's essential for heart health. Aim for at least 150 minutes of moderate exercise weekly. Activities like walking, swimming, or cycling can lower blood pressure, strengthen your heart, and improve circulation. Even small amounts of movement throughout the day can make a difference. High blood pressure is a major risk factor for heart attacks. Monitoring your numbers and taking prescribed medications consistently is crucial. Reducing sodium, quitting smoking, limiting alcohol, and managing stress can all help keep blood pressure in check. If heart disease runs in your family, have an open conversation with your doctor. Share your family history and discuss whether specialized screenings or preventive medications might be right for you. Regular checkups and discussions with your healthcare provider are key to catching any issues early. Don't skip appointments, even if you feel fine. Prevention is about proactive choices. Start today for a healthier tomorrow. Conclusion: recognizing the early warning signs of a heart attack can truly save lives. Symptoms like chest discomfort, shortness of breath, radiating pain, cold sweats, unusual fatigue, nausea, or an unexplained sense of doom should never be ignored. The earlier you seek treatment for a heart attack, the better your chances for successful recovery and survival. Remember, heart attack symptoms can be different for everyone, particularly for women, who often experience more subtle signs. Trust your instincts. If something feels wrong, it's always better to seek help and be wrong than to ignore symptoms and risk permanent heart damage or worse. Your health is your most valuable asset, so don't hesitate to call emergency services if you notice any unusual changes. A simple call could make all the difference. If you found this video helpful, give it a thumbs up, share it with others who might benefit, and subscribe to our channel for more health-related content. Together we can raise awareness and help more people recognize these critical warning signs. Stay informed, stay proactive, and take care of your heart. See you in the next video.